Good afternoon, respected dignitaries, esteemed panelists, dear colleagues, and all participants. On behalf of Dr. B.V. Krishna Rao, the Senior Director of Maheshwara Medical College and Hospital, we welcome you all to today's Knowledge Series proceedings. Today we are indeed honored to have with us very distinguished speaker, Dr. KAMESWARI SAMAVEDAM, a distinguished gynecologist, research scientist, and a social healthcare advocate, and Dr. PRAKASH, VIJAMUTI, an MHA from Tata Institute Social Science, now the founder and chief functionary Life Heal Reinforcement Group. On behalf of the management, all staff and students, we would like to welcome you to Maheshwara Medical College and Hospital. We would also like to welcome Shri D. Chakrapani, retired IAS, who is our consultant and mentor and a very known face.
Before we proceed further, I would like to take this opportunity to introduce our college to our esteemed dignitaries. Maheshwara Medical College and Hospital is a 1200-bedded tertiary care teaching hospital. It has 150 UG students per batch and 55 PG residents per year. It has state-of-art infrastructure and high-quality tertiary care facilities. It has fully equipped ICUs with self-sufficient oxygen generators and NAPL-accredited laboratories including BSL-2+ molecular lab, providing safe and quality center patient care. Maheshwara is at a platform much higher than other medical colleges with a name in this rapidly industrializing urban landscape. To carry forward with today's session, I invite to the dais Shri D. Chakrapani, IAS, retired, Sir. Shri D. Chakrapani, IAS, retired, State Civil Services, Director, Center for Innovations in Public Systems, Hyderabad.
I request Dr. B.V. Krishna Rao, sir, to the dais. MS Andhra University, Visakhapatnam, 1989. PhD Andhra University, Visakhapatnam, 2002. We invite Dr. KAMESWARI SAMAVEDAM ma'am onto the dais. We welcome Dr. PRAKASH VIJAMUTI, sir, to the dais, please. We would now like to felicitate our guests to have taken their time out to be with us this afternoon. Firstly, Dr. KAMESWARI VIJAMUTI. Dr. Samavedam Venkata Kameshwari is a highly respected gynecologist, research scientist, and social health advocate with over 23 years of experience in women's healthcare. Holding an MBBS DGO, she has combined clinical practice with an impactful community outreach, serving both urban and rural populations since 1999 through her clinics and her life health reinforcement groups. Her work spanned research, public health advocacy, and authorship with a key contribution to maternal health studies, early hysterectomy support system, and women's reproductive rights. Notably, she has achieved a 93% success rate in managing secondary infertility, benefiting over 10,000 women. A founding member of the Third World Women in Science, She is also actively involved in awareness programs through media and writing. Her efforts have earned multiple prestigious awards, reflecting her commitment to ethical healthcare research and women's empowerment. I would like HOD Ma'am, Obstetric and Gynecology, Dr. Nazima Alauddin Ma'am to come and facilitate.
Dr. PRAKASH VIJAMUTI sir is a public health professional with qualifications in MBBS and Master of Health Administration from the Tata Institute of Social Sciences. He is the founder and chief functionary of Life Health Reinforcement Group, Life HRG, established in 1999, and leads innovative community initiatives from Andari Illu or Open House in Hyderabad. His flagship program, Andalaina Jeevitam, Beautiful Life, reflects over 4 decades of thought, action, and exploration on the purpose of life and holistic well-being. He has over 30 years of experience in the development sector, having served with the Catholic Health Association of India and the Bharat Vikas Parishad in key public health roles. His work spans community health, research, and advocacy with presentations at national and international platforms and contributions to areas such as STI awareness, HIV/AIDS, NGO management, and food safety. Dr. VIJAMUTI has received several prestigious recognitions, including the Sadhguru Gnanananda National Award, Kirti Puraskaram by Potti Sriramulu Telugu University, Hall of Fame awarded by Civil Society magazine, and the R.R. Ketan Gold Medal for his lifelong contributions to rural women's health. He also served as a member of the Child Welfare Committee under the government of Andhra Pradesh, reflecting his sustained commitment to social development and community development. Now I request Mary Krishna Rao, Senior Director, sir, to felicitate Dr. PRAKASH VIJAMUTI, sir. Now I request everyone to please rise for national song. And next we would like to proceed with the traditional lamp lighting. I would like to request Nagaraj sir and principal to please join the lamp lighting. I request Dr. Nazima Alauddin ma'am, Professor and HOD, to please join the lamp lighting.
The lighting of the lamps, the beginning of new ventures, and dispels the darkness and illuminates our path of knowledge and wisdom and hope. I would request all the dignitaries to take up the gallery seats, please.
Welcome to Knowledge Series 7. We cordially invite you to share your insights and inspire our medical students on the following topics. First, Save Uterus, Our First Home, by Dr. KAMESWARI SAMAVEDAM ma'am. Next, Social Dimensions of Hysterectomy, Community Action for Prevention and Care, by Dr. PRAKASH VIJAMUTI sir.
I would like to welcome our Dr. Nazimuddin Alauddin ma'am, HOD Obstetrics and Gynecology, onto the dais. It is a distinguished honor and a personal privilege to introduce our HOD of department, Dr. Nazima Alauddin ma'am, to lead today's seminar on Save the Uterus. Dr. Nazima Alauddin is an alumna of the prestigious Deccan Medical College, where she completed both her MBBS and MS. With a career defined by clinical excellence, she has served as a senior consultant across a diverse range of premier government and private institutes, gaining a unique perspective on how healthcare challenges facing women in the region. However, beyond her clinical acumen, Dr. Nazima Alauddin is most widely respected as a dedicated mentor and a guide. She has been shaping the career of several generations of post-graduation, instilling in them the same precision and empathy that defines her own practice. As we discuss the 2026 updates on uterine preservation, we are incredibly fortunate to have a leader who bridges the gap between the traditional surgical wisdom and a modern preventive medicine. Please join me to welcome our HOD ma'am, Dr. Nazima Alauddin. I would request ma'am to have a few words.
Good afternoon, respected delegates, staff, students, and doctors of this medical college. On the behalf of the Department of Obstetrics and Gynecology, it is my privilege to welcome you all to this panel discussions. Today, Dr. KAMESWARI Madam and Dr. Prakash sir. This gathering brings together minds committed to excellence in women's health in the field that constantly evolves. Such platforms are vital not only to update our knowledge, but to reflect and implement. I encourage each one of you to actively share your insights, and take back meaningful learning that will translate into a better practice and care with the patients. Wishing you all highly productive and enriched panel discussions. Today's topic, the uterus, it's not just an organ, it is our first home. It nurtures life, it protects life, that ensures the continuity of the pregnancy across the generations. Today, while hysterectomy remains a life-saving procedure, when truly indicated, we must reflect on a growing concern It over-rescues in situations where conservative management could surface. Save the uterus is not just a slogan, it is a responsibility to carefully evaluate the indications, to prioritize medical and minimally invasive treatments, and to preserve a woman's physical, emotional, and hormonal well-being wherever possible. Every uterus removed unnecessary is not just a surgery performed, it is a part of identity altered. Let us commit to evidence-based practice, patient education, and ethical discussion making, because saving the uterus means respecting the first home of every human life. You are all aware that the knowledge series are initiated with an aim of bringing diverse perspectives on various subjects while also addressing students' needs under the tagline, "You ask, we deliver." You meet our proposal objectives. I suggest encouraging active participation from the interns, PGs, and TSI students by inviting them to share their opinion during today's interactive sessions. Thank you.
Thank you, ma'am, for sharing your views and opening today's interactive session. To set the ball rolling and continue with the same, may I now invite Dr. KAMESWARI SAMAVEDAM ma'am to speak, and I would request the speakers to present for about 7 minutes and leave the topic for discussion thereafter.
I have sent to Krishna Rao garu. ఉంది అదే ఫస్ట్ స్లైడ్ అండి. హలో అండి, అందరికీ నమస్కారం. Actually, we started this work way back in Sadasivpet in 2001. We identified this issue of unethical, unindicated hysterectomy in Priyadarshini spinning mills in Sadasivpet. We were running a rural clinic there, and we could identify all the 300 women working in that spinning mills who are under 30 years old. All were hysterectomized. That was actually a rude shock for us, for both of us, Prakash and me. So we started working on that, and you can see in that banner all the 25 years of work, what we did, how we fight against Arogyashri, removed hysterectomies from Arogyashri, all the issues you can, all the timeline you can see in that banner. I'm not going to brief you on that things, but why this Save Uterus campaign, as Madam HOD Madam already briefed us about evidence-based medicine. Now the reality is most of us are not practicing evidence-based medicine. That is an issue. Because why I'm saying, I'm giving this statement is, you can see, go to third slide, Andy. This you can see in Telugu. Same one you can see in English. Both the languages are there in the slides. You can see here in Andhra and Telangana, the numbers are rising from last 10 years. And they were high before also. So the high numbers are, you can see from national average is only 3. And in Andhra and Telangana, the average is above 8. So you can see only 3 per 100. But you can convert into lakhs and crores of women, the numbers are really high. So till date, till 2015, 1 crore women's organs are removed in India. So out of them, highest in Andhra, next by the time women reach 49-year-old, so most of them, 22% of their organs are removed. So the complaints they are saying is heavy bleeding, fibroids, ovarian cysts, and in Bihar is in 3rd place. Andhra, Telangana, Bihar and Gujarat. These are the four states you can see the numbers are really high. The numbers are increasing. From 2015 to recent NFHS data, NFHS 5 is showing the numbers are rising. So you can see the based on districts also. These 26 districts, more than 7%. All the 26 districts except 1 district in Bihar and 1 district in Gujarat, all other districts are from Andhra and Telangana. So you can see all the brown, dark, thick brown are 26 districts, all of them from Andhra and Telangana. More than 1 crore women. So you can see district-wise statistics here. Varangal top, almost if national average is only 3%, in Varangal almost 5 times more organs are removed. So now the Varangal district is divided into 6 districts, and you can see Guntur, then Nizamabad, Krishna, West Godavari. Only 6th one is Bihar. Again 7th one is from our Telugu state. So all the 6 districts are divided into so many districts now. The geographical area is same, the numbers are same. So now the question why? Why these many surgeries are happening? So NFHS data only collected patient information. They don't have any discharge summaries with them. They don't have any information about ovary removal or any other organs are removed simultaneously with hysterectomy. In our experience in Medak, most of the time they remove uterus, both the ovaries, along with appendix. Even for thumb pain, toe pain, any epigastric pain, any pain in the body, the root cause is only, root indication is only uterus, presence of uterus. So no evidence-based medicine is practiced here. So now you can see here, the highest is Varangal, followed by Guntur, Krishna, West Godavari, Karimnagar and Nizamabad. You can see here all the 4 states. Now the number of districts, 26 districts, most of them are from Andhra, Telangana. So now why? Why is the thing only information women are getting is after pregnancy and after delivery. Anyway, you had tubectomy, the uterus has no role. So no need of having periods every month. So if you retain uterus, you may get cancer. These are the 2 serious, rampant, unhealthy propaganda is actually, if you talk to any women, they say these 2 things. So is it the propaganda is correct? Is it the information is correct? No. So all the recent surveys, international studies, they followed women for more than 30 years. Most of the study actually have sent all the references to Krishna Rao Garu. So you can see, as medical students, you can see all the references about this page. So almost I have 20 or 30 references. All are published in international journals. So just what they are saying is, if you remove uterus and ovaries, or without ovaries also, if we do before 52 years of age, women will get 20 issues. So all the issues are, you can see here, osteoporosis, stroke, depression, anxiety, dementia, and very serious, interesting is all these women are having more risk of large bowel cancers. So most of them are doing cancer to prevent uterine and cervical cancers. They are having more chance of other cancers. So these are the serious issues. You can see in the references page, 1.5 page references were given. You can study there all the surveys, recent surveys, population-based cohort studies, longitudinal studies, systematic reviews, worldwide showed the association of hysterectomy with increased incidence of 20 new issues. Because most of us know, before 52, most of them are healthy because of properly functioning ovaries and uterus. So unlike male, they have more protection against cardiac issues, and they'll have healthy lipids, more HDL will be there. So they have most of them are not hypertensive, not diabetics. So by removing organ, uterus, before age of 52, so they are more susceptible to all these issues, all the age-related issues. So what are the absolute indications for hysterectomy? You can ask me, if based on your talk, all hysterectomy can be banned. No, hysterectomy is really life-saving in these situations. Absolute indications are there and relative indications are there. Most of the relative indications are heavy bleeding, pain, patient symptoms. You should not treat patient symptoms. You should know the root cause and try to treat it first before treating the symptoms. So most of them in our, we did a study in Medak from 2008 to 2011 in Peddachalmada. Most of them are, you can know the geography here. We worked in 40 villages nearby Peddachalmada, Chinnachalmada, Kamkol, Budara, and if you know the neighboring villages, we worked in there. So we collected the information from them and studied their blood biochemistry and compared their bone density with rural poor women. All the 170 women's bone density is much worse than rural poor women. So that is a serious impact. All these women got hysterectomy before age of 40 and their FSH values are increasing. So even without oophorectomy. So this is the serious thing here. So you can see all the absolute, if as postgraduates in gynecology or any other profession, a textbook says many things, but you should understand the women and their social background. As Prakash will share about all the social issues related to it and also how to prevent the numbers, Prakash will share that part. But in my 20 or 26 years of career, I only prescribed hysterectomy for very few. Maybe I can say below 10. So those are only indicated. So all other without indication, because most of the studies you can see in the Google or you can see in the most of them will have childhood trauma, psychological issues can be there, why they are having so many pains without any clinical evidence. So there you have to see their family, domestic violence or any other violence in her life, day-to-day life. So you should understand that, because in studies what they're saying is women in West, not in India. So in West, women having hysterectomy and oophorectomy at a young age, they face childhood trauma. So because of the trauma, they are only saying physical complaints. So you can see here very early cancers, grade 4 prolapse, more than 12 weeks fibroid, atonic PPH, placenta accreta, and also rupture uterus. These are the absolute indications to save a woman. So what this Save Uterus campaign mean? So only remove uterus when it is really indicated, because the cancer risk, as most of the medical students know here, only 18 per 1 lakh of cervical cancer, or 4 to 5 per 1 lakh endometrial cancer, and less than that is ovarian cancer. These are the 3 important cancers in that area. So other vulval, external genitalia cancers are much rarer. So here, so the number of cancer risk is very, very low when compared to number of hysterectomies happening. Number of hysterectomies happening is 23,000 in Andhra, 20.5 thousand in Telangana per 1 lakh women. When compared to that, cancer risk is only 18 for cervical cancer and also endometrial and other cancers. So here, do hysterectomy only when it is properly indicated. That's one thing. Second is, once uterus is preserved, improve the lifestyle, because most of them we see they have fibroids, heavy bleed, most of them are anemic, vitamin D deficiency. So if you see most of our rural women or urban women, so we have to improve their lifestyle through proper nutrition or proper medication. So improve nutrition, screening test. Now here our HPV comes. Now the WHO guidelines, what they are saying is, previously they used to recommend 2 screening tests for cervical cancer. One is pap smear and second one is HPV testing. Now they are recommending only HPV, because pap smear has inherently more limitations, drying up smear, not taking proper smear. So all the pathology related limitations there and more human intensive. So this HPV DNA testing is much easier, not human intensive. So now if HPV testing is negative, you can repeat the test after 5 to 10 years. In women's lifetime, 1 or 2 times you can do the test and you can see whether she is having any risk for cervical cancer. If it is positive, you can go for pap smear. If pap smear is also positive, you can go for colposcopy. Like this entire pattern is called screen, triage and treat. So this is a, actually we are working on this level now. How to save uterus is, one, you should not remove it without proper indication, because it may cause 20 new issues to the women. So now after retaining the uterus, we have to do this testing for all of women. So you can, most of them followed the recent ICMR press release. If you can, I can share with madam also. They actually declared they could do 8 crore women screening, not HPV or not pap smear. They did vaginal inspection with acetic acid. So as most of you know, as gynecologists, is not sensitive test or specific test. Most of women had cervical infection. Cervicitis also can cause false positive testing. So how they did, we don't know. But based on WHO, we should screen 70% of the women with high quality screening test. Vaginal inspection with acetic acid is not high quality testing. So, but they did for 8 crore women, but our population is much higher. They could cover only 20 or 15%. So you can see the pap smear here. So then what is this human papilloma virus? So most of the postgraduate students or gynecology students are also undergrad students can will know about this virus. Is a very serious virus. It can cause cancer. It's a carcinogenic virus. So it can cause cancer in 6 different places in human body. Even male also will affect. Penile cancer is a risk for male, and cervical cancer, oropharyngeal cancer, anal cancers, and all other cancers involving stratified squamous epithelium is a serious thing here. So most of them know about government's initiative about vaccinating all the girls under 14 now, but it can give us only 70% of protection. So that is a thing. And also first vaccine is released and started vaccination schedule less than 20 years back. So what the real serious effect on invasive cancer is not very well documented now. So these are the serious issues. Even after vaccination also we have to follow the women with pap smear. So all these cancers, what is the etiology and also what are the cancers, you can see here. No, this is the important thing. So to screen the women with high quality testing, most of them cost only 500 to 600 rupees testing. So in non-commercial way, you can screen the women at 35 years and also at 45 years. It can give them, because why this cancer cervix is so much important in Indian context is we contribute 25% of cancers worldwide from India. So we contribute to 25% of cancers. So if we can reduce our numbers, because most of our women, because lack of high quality screening test, we are identifying most of the cancers in advanced stage, and we are able to save only 40% of our women once they diagnose cancer. So when you compare with Bhutan and Australia, they are doing very well. So almost their cancer incidence is only 4 per 1 lakh. They are able to reduce the cancer incidence so much because of high quality cancer screening tests. They could identify cancer very early, like screen, triage and treatment. So that is the power of modern technology. So now what our Indian government is saying, I don't have money, I can't do these many tests. But Turkey is doing, and also most of the developed countries are doing, and Australia is doing, and our neighboring very small country, Bhutan is doing. Bhutan is doing very good. So we have to understand these things. Once we do HPV test once, if they are negative, her lifetime cancer risk is very, very less, because 99% cancers are caused by HPV. So now cancer risk is not there. We need not subject her to any other investigation. We can see her after 5 or 10 years and do another test. If HPV is positive or 16 or 18 are positive, we have to do pap smear. So now the guidelines are changed. You can do with your medical college and you can do in this district. So we can do 2 good things to women. We can protect her uterus and also have long-term life for her, long-term quality health. So that's one, and also we can protect her against cervical cancer. If it is there, we can identify and treat it very early, and we can have more survival or more healthy survival for the women. Thank you. So any of you, we can read in Telugu. We can give you all the information. So whatever the campaign we are planning in all the 59 districts of Andhra and Telangana. So we are identifying students, most of them from 20 to 30-year-old students and young adults, because the future is yours. You should do this, and like polio, like we can eradicate, we could eradicate polio from India because of our vaccination, and also most of the NGOs and government participation. Similarly, we can definitely another 20 years, we can remove cervical cancer from Indian map. Thank you.
Thank you, ma'am, for sharing your thoughts and ideas on the topic. I would now like to invite Dr. Prakash VIJAMUTI sir to speak.
Listen, I don't need that. So, hello friends, there at the end, the last one, just lift your hand. The one at the end. Yeah, what's your name? Please. Yeah. Your name. Shout. Has somebody pass on her name to us here? Yeah. And this side, anyone please? Kindly sit, Amma. This one? Anyone? Yes. మీ పేరు బాబు? ఉమేష్. ఉమేష్. సో అందరూ అంతా చివరి ఉండక్కర్లేదు, ఇదేమి స్ట్రిక్ట్ ఎరీనా కాదు. People who like to come forward, please come. And this brown is pretty neat. One who can also sit here or stand. This is our country. I just like to say this. This no, let's not be allowed to be like this. We are wife and husband. Okay. So yeah. So this is my 43rd year in social work. Okay. So I'm sure the guys with 21s and 18s and 19s here. So we took around 43 years to do what we have done today. So kindly sit, Umesh. Thank you so much. Please clap for him having stood. Next 1 hour would be more of sharing, where it's an interactive thing. So I have one of the most respected gentleman with us, and he's the one who brought us here, Sri Chakrapani Garu. We like to thank him to begin with. And he is, though retired, he's never tired. He's always on his foot, so continuously. So essentially, here, how many people are keen to know about our journey? Just lift your hands. How many? Yeah? Thank you so much. It's a great honor. The two diseases that made me take up social work as my area, that is my sister who had a tricuspid atresia, and she passed away while she was 20, and my brother passed away with primary pulmonary hypertension. So she died at 20 and my brother died at 46. So the reality picture is that like each one of us, we don't know really what's actually baking within our communities. And with a great captain on the other end of the country, of the world, like Trump around, we keep getting challenges. So how many are with Trump? Can you lift your hands? How many are there with Trump? Is anybody with Trump? You with Trump? Sir? Oh, it's so good to hear. Then we can have a debate separately because none are with Trump. But here comes the birth of our organizational work. The work started when I was 18. I am 61 today. And we thought we have done our job. 42 years on my chest. You can't see from there. It is written beautiful life. We have more than 200 people knocking our doors every day. And then more than 30,000 families were blessed with kids. And we have 105 libraries across southern India. And we have one of the biggest library in Hyderabad. We have nearly 1 lakh volunteers spread across. It is a very loosely knit organization. We don't have any reference to any god or religion or region, language, politics, money. Why we took so much time is we never took support from any quarter who flag any of these. So it was a journey worth knowing because we thought because we worked for the country while I was I was young as 14 years. I was attending along with my father, listening about our national integration and our country and all that. It was so much infused into our system. I'm just madly in love with my country. How many people have traveled India? Just lift your hands. How many people have traveled across? Please, thank you so much. How many people here in students, how many people have traveled? If you have not traveled India, kindly every year identify one state and just go there and come back. It could be 3 days, 5 days, according to your availability. The reason why we are saying this is, the more you travel, especially in India, the love for India gets enhanced. So, I just summed up the work that we do, but the challenge that we, KAMESWARI and me, when we went into the field level, when we found out that none of the women who came to us are having organs, that made us take up this Save Uterus campaign. And this happened very well in Medak district. So if you walk along with us in the villages of Medak, in this area, I think many would recognize us because of the work that we have done for the women and for the local people. But did we really achieve? As anyone can ask us, did we really achieve? Did we really spend our life well? And that questions, they keep coming back to us. Because a decision by Trump, there another end, immediately the kitchen that we run, we ran out of gas. More than 200 people come and eat with us. So that made me think, the journey that once we accepted to be with the societies, the minute we have decided to be with the societies, I now understand Chakrapani Garu, why he runs around. He knows, though he was in the topmost decision-making situation, and he knows very well at the field level the situation is not the same. That's the reason he moves, different colleges, different districts, and he keeps sharing about the different groups and initiatives and individuals who are doing different activities. He promotes them. Now I understand what it means. What we are lacking right now is, that's a banner that you're going to see in the near future, that is maximize. Maximize is what the mantra that we need to look at. The statement that I made, the statement that I made is that yesterday we had a tomorrow. Because of war, we have today. So it is essential for us here. How many are from Medak district? Can you just lift your hands here? How many are from the Medak district? Or Sangareddy or the local districts? How many are here? తెలుగు వచ్చా మీకు? ఇక్కడ లోకల్గా మెదక్ కానీ సంగారెడ్డి ఎంతమంది ఉన్నారు? ఒక్కడు కూడా లేరా ఇక్కడ? 1 person. Yeah, please come here, ma. Can I see that hand? Please come. Just the person who has raised a hand from Medak district. Anyway, see, yes sir, like, so, thank you so much, thank you, please clap for her. Unless you come forward, because end of the day, like 4 o'clock is the cutoff point that we have, where we like to know how many are traveling with us in Medak district. So she will introduce herself. Yeah, you can introduce yourself. No, others will know. Come. Cheppandi, meer ekkadi nunchi cheppandi.
Myself, I am Pranaya. I am from Medak district, Narayan Khed.
Okay.
It is my proper, and I stay in Sangareddy.
Okay, thank you so much for coming. It's promising to see somebody here like this, because at that age we have started our journey. అంటే ఇక్కడ అంటే యాజ్ డాక్టర్స్, యాజ్ ఐ షుడ్ సే, మీరందరూ పిల్లలు కాబట్టి ఐ కాంట్ సే ఆల్ ఆర్ మై, అంటే నా ఏజ్కి మీరు పిల్లలు, చిల్డ్రన్ ఆర్ దేర్ హియర్. ఐ లైక్ టు సే దిస్, there are 3 things that really work on us. One is our profession, and then it's the passion that works with us, and the personal aspect of it, our own personal journey. What it was in 1999 is definitely is not the same now. Definitely it's not the same now, because I have a daughter who's a doctor, and she's a doctor in Singapore, in Duke US, and see what all the challenges that she's going through. And I understand my young friends here, what is it, what really goes on into your system. Maximize and annappudu, one of the fundamental things that I like to tell you is, మెడికల్ ప్రొఫెషన్ చూస్ చేసుకోకూడదు. ఓకే, మెడికల్ ప్రొఫెషన్ చూస్ చేసుకోకూడదు. చూస్ చేసుకుంటే యూ హ్యావ్ టు హ్యాంగ్ ఆన్ విత్ యువర్ పర్పస్. దిస్ ఓన్లీ ప్రొఫెషన్ దట్ గివ్స్ యూ లాట్ ఆఫ్ సాటిస్ఫాక్షన్ ఎండ్ ఆఫ్ ద డే దట్ యూ యూజ్డ్ ఇట్ వెల్. సో ఇక్కడ ఐ లైక్ టు ఆస్క్ కామేశ్వరి టు షేర్ like what I really get to whenever I see her, the amount of reading she does on every day, and the amount of reflections that happen around, it is a continuous one. Until then, full stop ledu. While she is continuing to be a housewife, while she is continuing to be playing as a mother, so many other roles. Especially women here, all the women here, ఒక్కసారి నుంచి ఉంటారు ఆడవాళ్ళందరూ, ఒక్కసారి అందరూ ఆడవాళ్ళందరూ as medical students. Yaar, no, it's filled with that, yaar. It's please clap for them, all men, and all men, please clap for your choice, sir. Please, I never knew this many women are around, and it gives us a great pride. Please, love you all for the, seriously. The reason is, please sit. The reason is very simple. Women being in profession is 100 times different from men being in the profession. They have the challenges, continuous challenges. Just imagine you being a professional, you are having these many challenges, especially my daughter when she has to do her her night duty, where she has to work for nearly 30 to 40 hours. In Chinese, she has to talk to them, and every minute they have to document everything, the cases and all that, and then she is having period during that day. And the pain that she goes through, and when she calls me, Nana, అని అట్లా phone చేసి చెప్పినప్పుడు, every day whenever she is going through the pain every month, అనిపిస్తుంది అడిగేది షీ ఆస్క్డ్ మీ వన్ క్వశ్చన్, మనకే ఎందుకు పీరియడ్స్, నా తమ్ముడికి ఎందుకు రాలేవు పీరియడ్స్ అని. వెల్ షీ వాజ్ యంగ్, షీ ఆస్క్డ్ దట్ పర్టికులర్ క్వశ్చన్. జస్ట్ ఇమాజిన్ మై డియర్ ఫ్రెండ్స్ హియర్, మై చిల్డ్రన్, ఒక చదువుకున్న వాళ్ళము, ఫైనాన్షియలీ అన్ని విధాలుగా బాగున్న వాళ్ళము, మనకి పీరియడ్స్ వస్తే మనం ఎంత కష్టపడితే. పనిచేసేవాళ్ళు, పొలంలో పనిచేసేవాళ్ళు, ఇఫ్ దే ఆర్ బ్లీడింగ్, వాళ్ళ చీరలను తడిసిపోతుంటే, అండ్ దర్ ఇస్ నో మెడికల్ హెల్ప్ ఫర్ దెమ్ టు గో ఫర్ ఎ ప్రాపర్ ట్రీట్మెంట్, టెల్ మీ రెస్పాన్సిబిలిటీ దేర్. చాలా అంటే జస్ట్ ఇమాజిన్, ఒక కాలనీ అంత ఆర్గన్స్ లేవండి. మీరు కనుక ర్యాండమ్గా మీరు అడిగితే కూడా, బస్సులో అడిగితే ప్రతి బస్సులో మీకు ఎవ్రీ ఆల్టర్నేట్ మనకి ఆర్గన్స్ లేవండి. ఎవరు బయట వాళ్ళు చేయలేదు కదా, డాక్టర్సే చేశారు. సో ఎసెన్షియలీ ఇవాళ ఈ ప్రోగ్రామ్ ఇక్కడ చేసినందుకు రావు గారికి అండ్ చిక్కప్పని గారికి ఐ లైక్ టు థ్యాంక్ దమ్, బికాస్ ఇట్ ఈస్ సచ్ ఎ రైట్ ప్రోగ్రామ్ ఇన్ ద రైట్ ప్లేస్. ఎందుకంటే మేము 1999లో వచ్చాము, ఇక్కడే స్టార్ట్ చేశాము. అండ్ మా వర్క్ అంతా, మా పేరు మీరు ఏలో గుర్తు వస్తుంది మా గురించి, ఎవ్రీథింగ్ మాకంటే ఏ అనగానే ఎక్కువ రాస్తారు మా గురించి. ఎంత పని ఉందండి, ఫ్రాంక్లీ మై చిల్డ్రన్, దెర్ ఇస్ సో మచ్ వర్క్ ఎట్ హ్యాండ్. యూ డోంట్ హ్యావ్ టైం యాక్చువల్లీ. 4 o'clock వెళ్ళిపోతే నియరెస్ట్ గర్ల్స్ హాస్టల్కి పోండి, ఎస్సీ ఎస్టీ హాస్టల్స్ ఉంటాయి కదా, వెళ్ళండి. ఆడపిల్లల్ని చూడండి, 90% ఆఫ్ దెమ్ ఆర్ ఎనెమిక్. మళ్ళీ ఫిగర్ కాన్షియస్నెస్, తింటే లావెక్కిపోతామని, అందరూ సన్నగా ఉండాలని, ఆ ప్రయత్నాలలో పాపం ఎంత ఛాలెంజెస్ దే ఆర్ ఫేసింగ్ త్రూ. దే ఆర్ నాట్ ఈటింగ్ వెల్, దే డోంట్ హ్యావ్ యాక్సెస్ టు ప్రాపర్ ఫుడ్. హౌ మెనీ పీపుల్ నో హియర్ కైండ్లీ ఒక్కళ్ళని ముందర, మనం ఆహారం ఏం పండిస్తున్నాం చెప్పగలరా తెలంగాణలో? ఒక్కళ్ళని ముందరకు వచ్చి ఫార్మర్ బిడ్డ ఉంటే చెప్పండి, మన తెలంగాణలో మనం ఏం పండిస్తున్నాం తెలుసా మీకు? ఏం పండిస్తున్నాము? నాట్ సింగిల్ థింగ్ దట్ ఈస్ యూస్ఫుల్ మనం పెంచట్లేదండి. మనము రైస్ ఒకటి, పత్తి ఒకటి నడుస్తుంది, ఒక్క పల్సెస్ కూడా మనం పెంచట్లేదు. వెజిటబుల్స్ అక్కడ అడపదడప ఉన్నాయి, కానీ ద వెజిటబుల్స్ దట్ యూ ఈట్ దే ఆర్ నాట్ ఫ్రమ్ తెలంగాణ, దే ఆర్ కమింగ్ ఫ్రమ్ ది నైబరింగ్ స్టేట్స్. పూలు ఇక్కడ నుంచి, మల్లె పూలు, జాజి పూలు మీరు ఏతున్నాయో అన్నీ ఆంధ్ర నుంచి వస్తున్నాయి మనకి. ఇక్కడ ఒక్కడు కూడా పూల చెట్లు లేవండి. ఇక్కడ పల్సెస్ మనం టాంజానియా నుంచి తెప్పించుకుంటామండి. నాట్ ఎ సింగిల్ పల్సెస్ దేర్ ఇన్ ఇండియా. అండ్ 1 మోనోక్రాప్ ఉన్న కంట్రీస్ కెనడా నుంచి మనం తెప్పించుకుంటామండి మన పల్సెస్. బట్ వేర్ ఎవ్రీ వన్ ఈజ్ వెరీ క్లియర్. ఇక్కడ నుంచి ఈస్ట్ దగ్గర నుంచి అక్కడున్న అబ్బాయి వరకు ల్యాండ్ రేట్ చెప్పమంటే చెప్తారు, ఎంత ల్యాండ్ రేట్ ఉంది, ఎకరానికి ఎంత ఉంది అది చెప్తారు. ఏ ల్యాండ్ నుంచి వస్తే ఆహారం పండుతుందో ఆ ఆహారం మనం పండించకుండా దాన్ని మనం ఒక విలువైన వస్తువు కింద ఎలా అయితే ట్రీట్ చేస్తున్నామో, ఎంత డ్యామేజ్ జరుగుతుంది అన్నది వి నో ఇట్. సో ఎసెన్షియలీ ఇవాళ ఒక 5 నిమిషాలు, 2 నిమిషాలు, 1 నిమిషమైనా సైలెంట్గా ఉండి మనం ఎవరు మాట్లాడకుండా 1 నిమిషము వాట్ ఆర్ వి డూయింగ్ అనేది ఒక్కసారి, వాట్ ఆర్ ఐ డూయింగ్, ద ఫుడ్ దట్ ఐ ఈట్ ఇస్. ఒకవేళ ట్రంప్ ఇఫ్ హీ డిసైడ్స్, ఐమ్ సారీ టు యూస్, వాడు అక్కడ డిసైడ్ చేస్తే ఇక్కడ నా గ్యాస్ లేకపోవడం ఏంటండి? జస్ట్ ఇమాజిన్, ఎనీబడి కెన్ డిసైడ్ లైక్ దిస్ టుమారో కదా, ఎనీబడి కెన్ డిసైడ్ లైక్ దట్. అంత కాంప్లెక్స్ సొసైటీలో ఉంటున్నాం మనం. అలాంటప్పుడు 1 నిమిషం మనము సైలెంట్గా ఉండి ఆలోచించి మళ్ళీ మనం మాట్లాడుకుందాం. 1 నిమిషము. కైండ్లీ థింక్, వాట్ ఆమ్ ఐ డూయింగ్, వాట్ షుడ్ ఐ బి డూయింగ్, వాట్ ఐ విల్ డూ అన్నమాట మనం ఒకసారి అనుకుని వెళ్దాం ఇక్కడి నుంచి. దానికి మేము మా ప్రాణాలు ఇస్తాము. ఎందుకంటే వైద్యానికి వస్తే అన్యాయం చేయడం ఏంటండి? షీఈస్ కమింగ్ విత్ ప్రాబ్లమ్ విత్ హర్ మెన్సెస్, యూ విల్ ట్రీట్ హర్, నాట్ రిమూవ్ హర్ ఆర్గన్ అండి. ఇది ఎవరో చేయలేదు కదా, మన వాళ్ళే చేశారు, డాక్టర్స్ చేశారు. 1 నిమిషం ఒక సైలెంట్గా ఉండి మళ్ళీ మాట్లాడదాం. Thank you so much for going silent. And now it's a business hour. A business hour lo manamu. I will take another 7 minutes most probably. How many are with us in relation to working for women's health అన్నది నేను అడగను, ఎందుకంటే అందరు ఆడపిల్లలు కాబట్టి you are all there with us. So I don't give that option. Okay, you are there. అయితే నా భార్య కాబట్టి చెప్తున్నాను. I'm sure madam also is there, your gynec madam. One of the best gynecologists is right in front of you. Okay, so resources there with us. And what all you need to do is take a call. ఇవాళే ఇది 1 minute అన్నాం కదా అని మా ట్రైనింగ్స్లో చాలా క్లియర్ చెప్తాము. ఈయన ట్రైనింగ్ చెప్పిన తర్వాత ఎలా ఉందంటే ఎక్సలెంట్ ఉంది, చాలా బాగుంది అంటారు. గేట్ దాటి మర్చిపోతారు. అట్లా కాదు. Take 1 day, 2 days or 3 days and come back to us individually as a group. We will definitely spare our time specifically because maaku work ki space ichindi Sangareddy, Sadasipet area. So we are indebted to it. We would love to share our knowledge with you people. Okay, ikkada let's make it more interesting. More ఇక్కడ లైబ్రరీ ఉందా మన నేషనల్ కాలేజ్లో? లైబ్రరీ ఉందా కాలేజ్లో? కాలేజ్ లైబ్రరీ ఉంది. లిటరరీ దాంట్లో అదర్ దాన్ మెడిసిన్ బుక్స్ చదివే వాళ్ళు ఎంతమంది ఉన్నారు ఇక్కడ? రోజువారీ థ్యాంక్ యూ సార్ మ్యామ్. ఎంతమంది ఉన్నారు? సగం ఎత్తుతున్నాను. నా కళ్ళు చూపండి. ఐ హ్యావ్ క్యాటరాక్ట్ డన్, మై ఐస్ ఆర్ నాట్ సో షార్ప్. సో చేతులు ఎత్తండి. చేయి ఉంది కదా. ఇట్ వాస్ ఇంగ్లీష్ ఆర్ తెలుగు లిటరేచర్. So for all those people who are, thank you so much. For all those people who are keen to get into reading other than your medicine books, it helps a lot. I promise that every month we'll make sure a writer comes and shares their books with you to your college. Whoever is interested, they can attend. Okay, every month. That's first promise I like to deliver to you. Okay, అంటే why we have established 105 libraries ఎందుకంటే what we do is very simple. వచ్చిన వాళ్ళకి అన్నం పెడతాము, రెండోది పుస్తకము, వాళ్ళ ఇష్యూస్ వింటాము. దట్స్ రీజన్ 42 yearsలో మాకు అంతగా రావడము, వచ్చిన వాళ్ళందరికీ మంచి జరగడం ఎందుకు జరిగిందంటే ఫస్ట్ ఆహారము. ఇక్కడ కిచెన్ ఓపెన్ ఉందా లేకపోతే వాళ్ళు వండి పెడితే మీరు తింటారా? హాస్టల్లో do you cook food here or do you eat served food? Served food. So how many are interested in cooking? You can lift your hands. Yeah, thank you so much. Cooking really helps to understand the health because it has studies shown the minute you stop cooking at home, the diseases have entered into our systems. ఏ ఇంట్లో అయితే రోజువారీ కుంపటి వెలుగుతుందో ఆ ఇల్లు ఎప్పుడు ఆరోగ్యంగా ఉంది ఫండమెంటలీ. సో ద సెకండ్ థింగ్ వీ లైక్ టు కాంట్రిబ్యూట్ టు యూ ఇస్ డ్యూరింగ్ దట్ లిటరరీ మీట్ we'll organize a good food festival also where you understand about the food and its importance. The two things which we can do because that is in our gambit. అయితే ఇక్కడ ఎందుకు నేను చెప్తున్నానంటే let's keep adding life to lives. First, let us enjoy this journey that we are in and start looking at what are the things that we can contribute, because ఇక్కడ ఉన్న పిల్లలందరూ చెప్తాను, make life more interesting by spending as much time, as much energy and passion. Somebody is interested in the music, somebody is interested in dance, somebody is interested in painting. Kindly lift your hands and share with that. వాళ్ళకి నేను ఆ కన్సర్న్ డిపార్ట్మెంట్స్ వాళ్ళతో will make sure those things are strengthened here. Because the more you nurture your passion, your profession gets strengthened. ఎప్పుడైనా సరే ప్యాషన్ కనుక మనం నర్చర్ చేస్తూనే ఉండాలి. ఎండ్ ఆఫ్ ద డే లైక్ వాట్ డిడ్ ఐ డూ అని వచ్చినప్పుడు ఇట్స్ ఒక డిఫరెంట్ ఫీలింగ్ యూ మైట్ గెట్. సో ఎసెన్షియలీ దీస్ ఆర్ 3 things which I promised to you. One is my friends here were here for One is the writer part of it and the food festival part of it. The third one is in an understanding with the management. I'm not bypassing the management, with the support and encouragement of the management. Let's make this medical college a lively place, an interesting place, and purposeful place. That's the, unless we add purpose, ఇవన్నీ వేస్ట్ అయిపోతాయి మనకి. Essentially, from our quarter, what we look at is ఈ particular damage ఏదైతే జరిగిందో, while we are finding out how we can support women whose organs are removed, each of us, let us pledge, అంటే మీరు మళ్ళీ డ్రామాలో ఉంటుంది లేదంటే మనసులోనే ప్లెడ్జ్ చేసుకోండి. ఐ సో మనసులో అనుకోండి. ఐ మీ పేరు ఎత్తుకోండి. ఐ సో ప్రామిస్ మేక్ ష్యూర్ henceforth if I meet a woman, I will take care of her health. I definitely will inquire about her menses and her issues around periods and do the needful. This promise you keep it to yourself. మీరు వెజిటబుల్ వెండర్స్ కానీ, కిరాణా కొట్లో కానీ, బస్సులో కానీ, ఇంట్లో పనమ్మాయి కానీ, ఎక్కడ కనిపించినా యూ జస్ట్ స్పెండ్ సమ్ టైమ్ విత్ హర్ అండ్ బేసిక్ టెస్ట్లు ఏమైతే చేయించాలో చూసుకొని అట్లీస్ట్ అడాప్ట్ at least one woman whose organ is removed and just follow as a passion. మీ ఏరియాలోనే if she is organ is removed under 40, just follow her. ఆమెకి ఏమవుతుందో చూడండి మీరు. what are the challenges that she is going through. ఇక్కడ ఉన్న వాళ్ళందరూ చేయవలసిన పని. and we will definitely walk along with you in this. It's not that we are just telling you to do this, but we will be walking along with you on this. and ఇవాళ నేను ఇంతవరకే చెప్పదలుచుకున్నాను. ఎందుకంటే నా తరఫు నుంచి నేను చూసింది ఏంటంటే దిస్ ఇస్ అవర్ కంట్రీ అండ్ దిస్ ఇస్ అవర్ సొసైటీ అండ్ దీస్ ఆర్ అవర్ ఉమెన్, రైట్? ఇట్ ఈస్ నెసెసరీ ఫర్ అస్ టు ప్రొటెక్ట్ దెమ్. అండ్ అవర్ బుక్ ఆన్ హిస్టెక్టమీ, ఆ ఫోటోగ్రాఫ్ గవర్నమెంట్ ఆఫ్ ఇండియా పబ్లిష్ చేసింది కూడా మన ఫోటోనే. అది మీరు హిస్టెక్టమీ మీద గవర్నమెంట్ ఆఫ్ ఇండియా పబ్లిష్ చేసింది కూడా మేము విజిట్ చేసిన ఫ్యామిలీయే. దాంట్లో చూపిస్తాం అన్నమాట. గ్రాండ్ మదర్కి యూట్రస్ ఉంది, ఇద్దరు గ్రాండ్ మదర్స్కి యూట్రస్ ఉంది, కోడలికి లేదు, కూతురికి లేదు, కానీ మనవలు పక్కనే కూర్చున్నారు. అది ఫోటో. ఆ మనవలు ఈజ్ అవర్ ఫోకస్ అండి ఇప్పుడు మనది. అట్లీస్ట్ వాళ్ళ వరకు ఇది రీచ్ అవ్వకుండా ఉండాలంటే మనం ఏం చేయొచ్చు అన్నది కలిసి ఆలోచిద్దాము. కైండ్లీ వి అప్రిషియేట్. ఒక్కొక్క రోల్ నుంచి ఒక్కొక్క ప్రశ్న వేయండి. అండ్ డోంట్ ఎవర్ థింక్ దట్ ఓన్లీ సబ్జెక్ట్. మీరు ఏమైనా అడగచ్చు, బికాస్ వీ వెంట్ త్రూ ఆల్ ది ఛాలెంజెస్. కాబట్టి చక్రపాణి గారు కూడా రిక్వెస్ట్ టు కమ్ ఓవర్ సో దట్ యూ కెన్ ఆల్సో. అవునా? అయ్యో, మీరు పైకి వస్తే ఎప్పటికీ బాగుండేది సార్. తప్పట్లు కొట్టండి సార్కి. సో ఎసెన్షియలీ వారి ముందర నేను ఈ మ్యాక్సిమైజ్ అనేది కీప్ ఇన్ మైండ్. చిల్డ్రన్, మీ పేర్లు తెలియదు అయితే పేరుని పిలిచేవాడిని. మ్యాక్సిమైజ్ అని పెట్టుకోండి. మీకు ఏది వచ్చో, మీకు ఏదైతే డెఫినెట్ వచ్చో దాన్ని స్ట్రెంగ్తన్ చేస్తూ పోండి. డెఫినెట్గా ఇది వచ్చి ఉంటుంది కదా, దాన్ని స్ట్రెంగ్తన్ చేసుకుంటూ ఉండండి. అండ్ రెస్ట్ ఇస్ రెస్ట్. ఓకే, ఇట్స్ అ టైమ్ దట్ యూ మ్యాక్సిమైజ్ ఎవ్రీథింగ్, ఎస్పెషల్లీ టైం. టైం చూసుకుంటూ ఉండండి. షార్ట్స్ చూస్తున్నప్పుడు కానీ ఏమి చూస్తున్నప్పుడు చూస్తే హాఫ్ అన్ అవర్ అయిపోతుంది, ఇలా చూస్తే కొద్ది అయిపోతుంది. చెక్ యూ టైం. దట్ 84,600 seconds that we have, 86,000 or 84,000? 86,400 seconds, nearly 1 lakh seconds ఉన్నాయి మనకి. ఆ 1 lakh seconds ఎలా వాడుతున్నాము ఒక్కసారి ట్యాప్ చేసుకోండి అండ్ ఎంజాయ్. డోంట్ వేకప్ విత్ సై మళ్ళీ కాలేజ్కి వెళ్ళాలనో అలా కాకుండా ఎప్పుడు కాలేజ్కి వెళ్తానో అలాగా లెట్స్ మూవ్ ఇన్ టు ది సిస్టమ్. And we will make it as colorful, as beautiful, as purposeful, as already you are in that journey. When I was listening to sir, I understand your college is very serious about the college and the work that you do. We will add on to that unconditionally. There unkoti endante maaku conditions levu, because maaku em akkarledu, because God has supported us and we continue to be moving with the commitment to the country. As long as we are around, only sickness, and if you are not in India, then only we don't make it. అదర్వైజ్ వీఆర్ హియర్. అంటే మేము మాటిస్తే మటుకు వీఆర్ హియర్. సో అలాగ చేయడం వల్లనే ఇవాళ ఈ 42 సంవత్సరాల్లో వీ కుడ్ ఎస్టాబ్లిష్. సో థ్యాంక్స్ టు ఈచ్ ఆఫ్ యూ ఫర్ లిజనింగ్, అండ్ ఐ లవ్ టు లిజన్ టు యువర్ క్వశ్చన్స్ అండ్ ఆల్సో కమిట్మెంట్స్ అట్లీస్ట్ ఫ్రమ్ 10 women హియర్. నేను అన్నది మీన్స్కి అది కూడా మీరు చెప్తే బాగుంటుంది. సో లెట్స్ స్టార్ట్ ఫ్రమ్ దట్ బ్యాక్ రో అండ్ వీ విల్ స్టాప్ హియర్. కైండ్లీ ఆస్క్ క్వశ్చన్స్.
Please introduce yourself, మీ పేరు, what you are studying, and then ask the question. Kuncham.
Good afternoon, sir and ma'am. Myself Nandini, I am studying 4th year. I would like to ask a question. What factors will you consider before deciding to save the uterus?
So we'll listen to the woman first, then understand her socio-economic situation. Then slowly most of them will open up about their social issues, domestic issues. That is third one. Medically, once absolute indication is there, only we'll remove the uterus. If they are not absolutely indicated, small fibroid, little blood flow, most of them they doesn't know how to quantify menstrual loss. Most of them say heavy bleed, but they're only losing 2 pads per day. Like that, you have to ask the menstrual history correctly, then improve their nutrition, like that. So if they're absolutely indicated, any cancer is there, very big fibroid, pressing on ureter, like that. So definitely if it is indicated, I'm not against removing. But if it is not there, we have to understand her social dynamics and other dynamics. We should understand and treat. If one, I can give you that example. One of the Vaisya lady comes to me and says 100 complaints, pains. And most of them, if she has any domestic issue at home, she'll come to me. She'll tell all her complaints and take vitamin D and calcium and go back. So she's coming since last 20 years to me. So most of the middle-aged women, young women, they have so many issues, like Prakash already shared. So family, career, and other nutrition and other issues. So we should understand women as a whole. Should not think only on uterus. So that's my what save uterus mean is understand women as full.
Thank you, ma'am.
Any other question, please? Yes, madam. Mic, in the mic again. And I would also like to know from which place do you come from? I mean, in future. Right, please go ahead.
Good afternoon, sir, ma'am. Myself Renuka from final year. Ma'am, my question is, what is importance of uterus preservation beyond fertility? Like most of the women's concern is once they conceive children, they get hysterectomy done. So what is importance of uterus preservation?
You asked the entire gynecology question here. The obstetric is over, the gynec is what it is, right? So the question lone answer undi meeku. So fundamentally, the same mindset is being there in the politicians. The same mindset is in the doctors. So that's the reason it happened, Amma. So essentially, kindly, if uterus is around, the entire health of woman is intact. Okay. So like మీరు ఎప్పుడైనా చూడండి, మీరు హిస్టెక్టమీస్ ఉమెన్ అండ్ హిస్టెక్టమీ కాని ఉమెన్ పక్కన కూర్చోబెట్టండి, సేమ్ ఏజ్ గ్రూప్. దిస్ లేడీ లుక్స్ 20 or 30 years older than her. So it only says what damage you are doing. Okay. All the systems they get affected. Just like smoking తాగితే ఎట్లానో, smoking తాగితే every organ ఎట్లా ఎఫెక్ట్ అవుతుందో, organ removal also the same issue.
because women have all the hormonal receptors, na? So you estrogen, alpha and beta receptors in each cell. So it works on brain, even lipid profiles, blood vessel elasticity, and also liver, skin. So you name the organ, every organ is dependent on estrogen. So if you see the Turner syndrome women, they have so many issues. Na? Similarly, you should not remove the organ. That's the thing, because uterus and ovary share common blood supply. Anastomosis is there. So ovary gets almost 50 or 40% of blood supply from uterus, uterine artery. So they share a common blood supply. So please read the references page. All the references are from the world level, statistics are there. So population surveys, all the surveys are saying you should not remove uterus without indication. If he has cancer, if he has life-threatening postpartum hemorrhage, rupture uterus, placenta accreta, I agree. All the things you have to remove. If it is in a lower center, if it is in a higher center, you can clamp the internal iliac artery and you can protect the uterus also. So you just see that all the statistics are saying don't remove uterus without indication. It is not a waste organ. So it has a role beyond reproduction. Okay.
Thank you, Dr. Prakash Vanjanari sir, for speaking your heart out and showing your commitment to our society. And also thank you for hand-holding our college for various domains. Now I request...
Interaction continues. It's not over. We have time still.
I was just watching where this coming from.
Now, Dr. Kameshwari, I have one point to make. Now, you said a number of references internationally. Is it possible to make a synopsis of those references and circulate among the students? Synopsis of those messages. President. No, not merely references.
Okay.
I am talking of a synopsis of at least the important ones, which maybe runs for about 15-20 pages ki English lo ganaka if it is there. My request to the college management is kindly have it circulated, and if they want they can have a debate among themselves, and then so that there is a little more of discussion. I think, as you notice, there seems to be some feeling that it's no longer needed, that kind of a... So, అది పోవడానికి వాళ్ళ మైండ్లో స్ట్రాంగ్గా ఇంపాక్ట్ కావడానికి దిస్ కైండ్ ఆఫ్ డిస్కషన్ ఈజ్ నీడెడ్, అండ్ ఐ థింక్ షీ రేజ్డ్ వెరీ వ్యాలిడ్ పాయింట్. సో మై రిక్వెస్ట్ ఈజ్ నాట్ merely the references, the synopsis of those references. They may not have the time to go through all the references. Do you agree, sir? Krishna Garu? Right. Sorry. Any other question? Yes, Amma. First, then we'll come back to you. Why did you come to the front row so that we can catch you? You can catch our eyes easily. Come. You can even come to the middle and then ask your question. Now, Mike. Yeah.
Good afternoon, sir. Good afternoon, ma'am. Myself, G. Srinija from final year. Do you think...
Where are you from?
Hyderabad, sir.
Hyderabad, right. Please go ahead.
Do you think seed cycling plays an important role in the prevention of conditions that lead to hysterectomy, ma'am?
సీడ్ సైక్లింగ్ అంటే సన్ఫ్లవర్ ఫ్లాక్స్ సీడ్ అవా? ఓకే. అయితే ఇక్కడ మీరు సీడ్ సైక్లింగ్లో హెల్దీ ఫ్యాట్స్ అంటే ఒమేగా-3 రోల్ ఉంది మనకి. అయితే మీకు దానికన్నా కూడా మన ట్రెడిషనల్ ఫుడ్లో ఆవాలు యాడ్ చేస్తారు కదా, ఆవ పిండి కూడా గ్రైండ్ చేసి వేస్తారు కదా, అది ఒమేగా-3 రిచ్ ఉంటుంది. ఇప్పుడు ఫ్లాక్స్ సీడ్లు ఏమవుతుందంటే ఫ్లాక్స్ సీడ్లో లిగ్నాన్స్ అని ప్లాంట్ హార్మోన్స్ ఉంటాయి, ఫైటోఎస్ట్రోజన్స్ ఉంటాయి. they can cause some disturbances. So don't blindly follow YouTube. సో అది కాదు.
అలాంటి వాడికి సీడ్ సైక్లింగ్ అంటే ఏంటి చెప్పండి.
సీడ్ సైక్లింగ్ అంటే సార్ అది ఫ్లాక్స్ సీడ్స్, సన్ఫ్లవర్ సీడ్స్, పంప్కిన్ సీడ్స్, దెన్ దాని పేరేంటి బాదం, అది ఆల్ అదర్స్ సీడ్స్ దే ఈట్ ఎవ్రీడే. సో అయితే సమ్ ఆర్ గుడ్ బట్ సమ్ ఆర్ నాట్ గుడ్. So like sunflower, you know omega-6 is high in sunflower. It is not good for anti-inflammatory effect. It is more of inflammatory effect. So don't go by YouTube blindly and see your grandmother. So what they ate. So like Prakash already shared, na, both the grandmothers had uterus and they are healthy. The girl's mother removed organ, but we have to protect the girl. So more than seed cycling, avoid junk. Avoid junk, take millets and brown rice. And we have 525 varieties of greens in Andhra and Telangana. Like already Prakash mentioned, na? So we have edible greens, 525 varieties. So our states are biodiversically very, very rich.
Do you include pizzas and burgers in junk?
Yes. Pizza, burger, pani puri, all things will increase in Manchurians, all increase menstrual pain. All junk will increase because most of the medical students do the prostacyclin and prostaglandin pathway, eicosanoids, and you know, na, all the painkillers work there, and all the inflammatory markers are increased with junk food or all processed food like noodles. So avoid them first. Take green every day. Eat home food. That's more important than seed cycling. Thank you.
There's one more person here. Yeah. Please introduce yourself, your area of study, year of study, and then place that you come from.
Good afternoon, sir. Myself Sai Preeti. I'm from Warangal and I'm an intern, sir. My question is, we are asking...
You are doing your internship here?
Yes, sir.
You finished your studies?
Yes, sir.
Wonderful.
Housemanship, okay.
Yes, ma'am.
Okay.
We are asking we are asking the women to preserve the uterus. Though we are preserving the uterus, many people are exposing to the unopposed estrogen exposure, so that they're landing into AUB conditions. So why can't we correct it from the root level?
So you are asking DUB, dysfunctional uterine bleeding?
Yes, ma'am.
Okay. So unopposed estrogen action comes only during premenopausal years, not in before 45 or before 44. So all this comes around premenopausal, that is perimenopausal transition time. If it is there, why they are having those many unopposed action is, if they are obese, they are having xenoestrogen exposure like makeup, so any skin exposure to the chemical cosmetics, and also hair dye, all plastic, all animal foods like red meat, eating more red meat, all this will increase estrogen. If they are obese also, estrogen will increase. If they can have, that's why we in our slide we have given you the improved lifestyle. So lifestyle is very important to have a good uterine health. You can save the uterus, and also her long-term health will improve. Because if women have early menopause, their life expectancy is also reduced. So that estrogen is directly connected to your lifespan. So that is very important. So you can control the unopposed estrogen action with all these lifestyle changes. Some will have definitely cancer. Cancer risk is there, I agree, but that is very less when you compare with removal of organ. So if you have healthy lifestyle, and most in my clinic, most of women who are using hair dye, they are having more disturbances in their periods. I never use my hair dye, my hair, na? I had smooth menopause. So I'm now 54. I reached menopause at 49 and smooth menopause. Had only 2 or 3 cycles were problematic. So like that, we eat at home food. We never use non-veg, and we won't eat outside food, and I never use cosmetics. Though I'm little obese side, but my cycles were okay. Like that, most of women are healthy. So don't think they are having any disease. So you can make them more healthy by doing all these things. So they can eat healthy, they can have healthy lifestyle, because menopause is not a disease. So all are physiological changes, like menarche, pregnancy, lactation, and also menopause are all physiological. So sometimes they have a pathological tendency. You have to, as a doctor, you have to gauze for that, that's all. Should not intervene too much. Okay. Thank you.
Further questions, please? I don't find boys. Yes, sir. Mike. Ikkada. Yeah, intro. I think she wants to ask a question. Yeah, please go ahead, sir.
So I am Dr. Pradeep Reddy. I am Professor of Pediatrics at this place, and I come from Secunderabad. So firstly, hats off to you both, sir. Amazing, amazing, amazing work. My head really bows in respect to you. Why? Because I mean, this is a topic which is very close to my heart, and as my good fortune would have, my wife is a gynecologist, and she's been doing this work since 1999 in a place called as Ramaram, which is a village which comes right now in Siddipet district. In 99, when we bought a piece of land, she was utterly shocked that in 40 villages around that particular village, there was not a single lady below the age of 35 years and above the age of 28 years who had a uterus. This I'm talking about 28 to 35-year-olds in the year 1999. And after that, as a luck would have it, she didn't of course make a count, but I do have a rough count. Till now, I think it's been almost 10,000 women who have managed to have their uterus preserved. Now, having said that, but I think it's people like you who seem to have done a wonderfully standardized, I would say, scientific work, and I only hope that your work gets reflected all over Andhra and Telangana, because these two Telugu-speaking states, being a pediatrician, I don't know how many of you know this, Andhra and Telangana are the caesarean capital of the world. People who do not know, 80% of the deliveries in these two Telugu-speaking states right now for the last 15 years are being delivered by caesarean. I'm not talking just about private hospital, even government hospital. So Andhra, Telangana are the caesarean capital of the world. Being a pediatrician, another part they do not know is we are the malnutrition capital of the world of under 5 years.
Yes.
Which means that only 1 in 10 children of this part of the world are getting the right kind of minimum dietary diversity, minimum dietary intake. So we have this dubious reputation. And the third is Andhra and Telangana are the diabetes capital of the world. So very good reputation we seem to have had, and now I came to know that we are also hysterectomy capital of the world. So I think going by this, but the thing that I seem to be very impressed is that open house thing that you started, Prakash sir. Very, very great this thing, because I think reading habit is definitely going down the drain now, and I see that you people have caught on to something very, very good. I look forward to working with you both, and I hope, you know, God manages to make more Dr. Prakash and more Dr. Kameshwaris in this world, so that our profession starts getting its reputation back because the number of black sheep that we seem to be having in white coats is something which is very, very frightful. And with, of course, mushrooming of so many medical colleges, this problem seems to be increasing further. So unless we have more angels like you, I think our profession is going to have a bad rep. Thank you for saving the rep of this profession. Thank you so very much for giving me this chance. Thank you.
Here I like to say submit.
Sorry, I forgot another one capital we are. We are also the bottle feeding capital of the world.
Yeah.
So being a pediatrician, I can tell you that we are a bottle feeding capital of the world. So I don't know whether you can all address these 5 reputations of this Telugu speaking states. Yeah, that's where it is. Sorry sir, please go ahead.
Yeah, I just like to humbly submit that you are the first doctor in my publicly saying this. Because sir knows at least there were 5 attempts on us to eliminate till today, and yeah, I'm sorry. And in fact, last month one of the CEOs called me and said, if you continue like this, you'll be eliminated for sure. I said, till now it didn't happen. But what I'm trying to build up in here is Gandhi, while he was walking, he never used to sit, he used to walk. So Babuji, अगर मैं ये झूठा नहीं बोला ना, आज मैं मर जाता था. That's what the one guy said that. Then suddenly Gandhi turned and said, "Jana, अपना ज़रूरत है क्या?" He just looked at him. ఇక్కడ ఉన్న వాళ్ళు 2 మంత్రాలమ్మా, if you want to be happy, never lie. Never lie, no matter what. Suppose ఎవరైనా సబ్జెక్ట్ క్వశ్చన్ అడిగారు, మీకు రాలేదు, why do you worry? Tell them that I don't know. Nothing wrong saying no, because you got a great opportunity to learn first. And प्यार करते जाओ, इतना प्यार करते जाओ, लेकिन प्यार करने वाले प्यार करते शान से అంటే ఎంత ప్రేమించాలంటే మనం ప్రేమించుకోవాలి, ఇతరుని ప్రేమించుకోవాలి. ప్రతి అడుగు అంటే ప్రతి మాట ప్రేమతో ఉండాలి. ఇట్స్ నాట్ ది నెంబర్ ఆఫ్ ఇయర్స్ యూ లివ్డ్, వెదర్ యూ లివ్డ్ వెన్ యూఆర్ అలైవ్. దట్స్ అ క్వశ్చన్ వీ నీడ్ టు ఆస్క్ అవర్ సెల్వ్స్. ఎసెన్షియలీ దట్ యూ షుడ్ బీ, అసలు హార్డ్లీ మ్యాటర్స్ అండి వెదర్ యూ లివ్ ఫర్ హౌ మెనీ ఇయర్స్ అనేది ఈజ్ నాట్ ఎ క్వశ్చన్ ఎట్ ఆల్. ఐ టెల్ యూ టుడే, not a rupee we have taken unethically. Anything is ours. Anything that we are having on us, ఇది కూడా గాంధీ అదేది ఆగ్రా నుంచి ఎవ్రీ ఇయర్ వన్ లేడీ గివ్స్ మీ, దయాల్ బాగ్ నుంచి హ్యాండ్ ఓవెన్ బట్టిస్తుంది ఆవిడ నాకు. పీపుల్ నో దట్ ఐ డోంట్ జనరేట్ మనీ. My daughter, because she's earning, she bought me shoes. It took 20 years or 30 years, but the shoes that I have today is because నా ప్రైడ్ ఉండాలి కదా. సోర్స్ ఏంటి? డబ్బు. ఇది నా డబ్బు కాదు. ఐ లివ్ విత్ వాట్ ఐ హ్యావ్. ఇట్ టేక్స్ టైమ్. టుడే మై సన్ ఈజ్ అ సైంటిస్ట్, మై డాటర్ ఈజ్ అ డాక్టర్. షీ ఈజ్ 99.5 ఉంది. 2024లో ఎక్స్ట్రాడినరీ క్లినిషియన్ అని డ్యూక్ యూనివర్సిటీ వాళ్ళు డిక్లేర్ చేశారు 2024లో. షీ ఈజ్ డూయింగ్ హర్ ఇంటర్నల్ మెడిసిన్. ఆమె రామలక్ష్మి, గాయత్రి, వింజమూరి అని కొడుతూ ఉంటుంది. But just imagine, she's there in there, COVID time lo vellindi, and she really worked hard, and today she's somebody, and she's supporting my organization. She's supporting salary of one of my employees today. So, see, apna time aayega anadi chaala important thing. అతను అంటాడు, రణ్వీర్ సింగ్ అంటాడు, అప్నా టైం ఆయేగా. ఎవరైతే అబద్ధం ఆడరో, ఎవరైతే నిజాయితీతో ఉంటారో వాళ్ళ స్లో గ్రోత్ ఉంటుంది, బట్ దట్ గ్రోత్ విల్ సస్టైన్. బిలీవ్ దిస్ and hang on with this. And tell you, ఇక్కడ కూర్చున్న వాళ్ళు ఎవరైతే నేను ఆడవాళ్ళకి చేస్తాను అని అనుకుంటే చాలు, the God will start blessing you. If our women are healthy, the family is intact అండి. Family is healthy. That's the reason we need to work. So we are with you, and it's a fact that we are with you, and we will be with you. Kindly participate in this. Village by village, we will educate. In Medak district lo ikkada unnanduku we will educate about women's health. ఏమవుతుంది, 1 hour 1 Saturday ని డిక్లేర్ చేసుకున్నారు. మాకు గ్రామాలు ఉన్నారు, ప్రజలు ఉన్నారు, అలా చేసుకుంటూ పోవడమేనండి. ఇట్స్ సో లవ్లీ పీపుల్ అండి, గ్రామస్తులు చాలా అందమైన వాళ్ళు. సో జస్ట్ ఎంజాయ్ దిస్. థ్యాంక్ యూ సో మచ్ సార్. మీరు మాట్లాడడం వలన సో మెనీ పర్సనల్ థింగ్స్ నా వారు ఉంటుంది, అన్నీ చెప్పేస్తారు మీరు అని. అంటే అవర్స్ పబ్లిక్ లైఫ్ కదా. సో yeah, and just believe us, we'll keep our word. You throw the agenda to us. ఇది మేము ఇలా అనుకుంటున్నామని ఒక్కొక్కళ్ళు రియలైజ్ చేద్దామండి. అంటే ఇంటర్న్షిప్ చేసి వెళ్ళిపోతున్న వాళ్ళు మళ్ళీ పెళ్ళిళ్ళు అవ్వాలి, వాడు ఎవడు వస్తాడో తెలియదు, ఎక్కడ వాడో తెలియదు. ఆ ఛాలెంజెస్ ఉంటాయి ఆడపిల్లలకి, క్వైట్ ఛాలెంజ్ అండి. ఐ సీ త్రూ దాట్, ఐ నో అండర్స్టాండ్. అందుగురించి ఉమెన్ అంటే ఎందుకు ఇష్టం అంటే పాపం వాళ్ళు అన్ని ఇన్సిడెంటిస్ కదా, అన్నీ కరెక్ట్గా ఉంటాయి. వీ డోంట్ నో దేర్ ఆర్ మెనీ అదర్ ఛాలెంజెస్. అందు గురించి లర్న్ వెల్. లర్న్ అంటే సంబడి ఆల్వేస్, అంటే నాకంటే చిన్నది నా భార్య కాబట్టి, కానీ ఆల్వేస్ ఐ థ్యాంక్.
సార్ మేము ఫుడ్ అండ్ హైజీన్ ఎగ్జిబిషన్తోనే పిల్లల మాల్ న్యూట్రిషన్ చూసే ప్రకాష్ గారు లైఫ్ హెచ్ఆర్జీ సంస్థ స్టార్ట్ చేశారండి. సో ఆయన్ని థాయిలాండ్లో ఒక కాన్ఫరెన్స్కి వెళ్ళినప్పుడు ఒక ఎవరైన పేరేంటి,
హీ సెడ్ యూ ఇండియన్స్ యూ డోంట్ నో హౌ టు ఆర్గనైజ్ ఫుడ్ అన్నాడు. ఫస్ట్ విజిట్ టు థాయిలాండ్ కాలింది, అన్నీ వదిలేసాను, ఉద్యోగం వదిలేసి ఏంటని. దట్స్ హౌ ఇట్ టుక్ బర్త్. సో yes sir, yes sir, yes sir, yes sir. Sir, don't, already నేను బాగుండకుండా బరువెక్కిపోయింది. మీరు దాని మీద కిలో పెట్టేస్తే ఇక్కడి నుంచి వెళ్ళిపోయినప్పుడు ఎమర్జెన్సీలోకి వెళ్ళిపోతాం. No understand sir. Let's, yeah.
Any other questions, please? Yes.
Good afternoon, madam. Good afternoon, sir. Good afternoon, sir. So myself, associate professor in gynec department, working here since 3 years, sir.
మీ పేరు చెప్పలేదు.
Sir, my name B. Aparna, sir.
Right. Kindly go ahead. Sorry.
Many questions to ask, ma'am, but one question. So, madam, many patients with asymptomatic patients with fibroids will come, ma'am. So many they'll concern with this, madam, chinna gaddu undi kada, future lo problem aitadi. So we don't want to take the uterus. So we are using many drugs are there, ulipristal, state, mifepristone, letrozole. In your practice, what is your experience, ma'am? Just we have a doubt of how to use. We will use, but with your experience, I want some guidance, ma'am.
ఇప్పుడు ఈ ఫైబ్రాయిడ్ ఎలా గ్రో అవుతుంది అంటే 0.6% పర్ ఇయర్ అని 1 సెంటీమీటర్ పర్ ఇయర్ అని చెప్తారు. బట్ నేను చూసిన నా ప్రాక్టీస్లో వితౌట్ ఎనీ మెడికేషన్ హెల్దీ లైఫ్ స్టైల్ ఉంటే కొన్నిసార్లు గ్రో అవ్వట్లేదు. ఇట్స్ నాట్ గ్రోయింగ్. సో వీ కెన్ అబ్జర్వ్ దమ్. ఎసిమ్టమాటిక్ పేషెంట్ వీ కెన్ అబ్జర్వ్ దమ్. వన్స్ ఇన్ ఏ ఇయర్ స్కాన్ చేసుకోవచ్చు, వెరీ గుడ్ స్కాన్, ట్రాన్స్వెజనల్ స్కాన్ చేసుకోవచ్చు. ఇఫ్ దే ఆర్ రీచింగ్ మెనోపాజల్ ట్రాన్సిషన్ టైంలో మాత్రం కొన్నిసార్లు గ్రోత్ అవుతుంది, కొన్నిసార్లు తగ్గిపోతుంది సర్ప్రైజింగ్లీ. సో యూ షుడ్ గివ్ దెమ్ టైం. అసలు బిలో 4 సెంటీమీటర్స్ ఏం ట్రీట్ చేయొద్దండి. ఈ ఎలిప్రిస్టాల్ కానీ ఇవన్నీ కూడా లాంగ్ టర్మ్ సైడ్ ఎఫెక్ట్స్ మనకు తెలియవు. మోర్ దాన్ 1 ఇయర్ ఇస్తే ఏమవుతుంది అన్నది అన్నీ ఇప్పుడు మన గైనిక్లో కానీ ఆబ్స్ట్రిక్స్లో కానీ ఎక్కువ కేస్ కంట్రోల్ స్టడీస్ లేవు. అందుకని మనకి ఇవ్వకూడదు, మనం రాంగ్ చేస్తాము. వీ కెన్ అబ్జర్వ్ దట్ ఇఫ్ దే ఆర్ హ్యావింగ్ హెవీ ఫ్లో బేసిక్ మెడికేషన్ ఇవ్వచ్చు, లేదు డైట్ చేంజ్ చేయొచ్చు, డైట్ తోటి వైటమిన్ సప్లిమెంట్ చేయొచ్చు. అండ్ మోస్ట్ ఆఫ్ దెమ్ హెవీ చెప్తారు కానీ క్వాంటిఫై చేయమనండి. మోర్ దెన్ 7 days ఫ్లో 7 pads కన్నా ఎక్కువ అవుతుందా, బిగ్ క్లాట్స్ పడుతున్నాయా. నేను యాక్చువల్లీ మీకు ఆ ఇన్ఫర్మేషన్ ఇస్తానండి, నేను వాట్సాప్లో సార్కి పంపిస్తాను, మీ అందరికి పంపిస్తారు. మీరు చదవండి. ఈ 59 districtsలో మనం క్యాంపెయిన్ చేయడానికి అడుగుతున్నాం. దే ఆర్ రియల్లీ హ్యావింగ్ ప్రాబ్లం, డెఫినెట్లీ సబ్మ్యూకోజల్ ఉంది, రిమూవ్ చేయాలి. బట్ మోస్ట్ ఆఫ్ ద టైం విమెన్కి టైం ఇవ్వండి, మాట్లాడండి, ఏం కాదని చెప్పండి. మోస్ట్లీ ఏం అవ్వదు. మాలిగ్నెన్సీ ఛాన్స్ కూడా ఫైబ్రాయిడ్లో తక్కువ.
సో పేషెంట్స్ ఆర్ ఆల్సో దే ఆర్ మోర్ కన్విన్స్, మ్యామ్. ఇంకా ఏం కాదమ్మా అని వి ఆల్మోస్ట్ కన్విన్స్ చేసినా కూడా with some other they want to go second opinion, and by the time we are counseling them they are another doctors they are removing the
అంటే
uterus. This
ఇది
happens at
అది
the ma'am.
టైం పడుతుందండి, ఇది నిదానంగా బిల్డ్ అవుతుంది ప్రాక్టీస్.
yes, ma'am.
ప్రకాష్ గారు చెప్పినట్టు మీకు మీ మాట విని ఒక్క అమ్మాయి సరిగ్గా ఆర్గాన్ ప్రొటెక్ట్ చేసుకుందండి, అమ్మాయి ఒక్కటి చాలు మీకు,
Yes, ma'am. Yes,
షిల్ బికమ్ గుడ్ సోర్స్.
Yes,
అలా
ma'am.
అది నిదానంగా పెరుగుతుంది. ఇంకోటి వాళ్ళకు కూడా అంత తెలివి ఉండాలి కదా, మనం చెప్పింది అర్థం అవ్వాలి.
Many patients doesn't have more knowledge about uterus, ma'am. So
అది-
2-3 patients came to ma'am. Madam అక్కడ చిన్నదానికి సర్జరీ చేసేస్తామన్నారు, ఇక్కడ వస్తే అవసరం లేదన్నారు మేడం, and they gave positive feedback, ma'am. So because many patients doesn't have knowledge how to save the uterus, ma'am. If we educate them nicely, they it will be run.
మీకు ఆ నోట్ పంపిస్తాను, మీరు తెలుగు చదువుతారు కదా,
Yes, ma'am.
మీకు నోట్ పంపిస్తాను, మీరు ఒకసారి ప్రింట్ చేసి చదవండి, మీ పేషెంట్స్కి ఇవ్వండి, వాళ్ళని చదవమనండి.
Okay.
నేను ఆ నోట్ అందరిని కూర్చోబెట్టి చదివిస్తున్నాను, వాళ్ళకి ఆకలేస్తుందంటే 4 బిస్కెట్లు పెట్టి కూర్చోబెట్టి చదివిస్తున్నాను. చదువుతున్నారు, అర్థం చేసుకుంటున్నారు. ఏ మాత్రం చదువుకోని అమ్మాయికి కూడా అది అర్థమవుతుందండి, ఎందుకంటే అది వాళ్ళ బాధ, వాళ్ళకి రిలీఫ్ కావాలి కదా, వాళ్ళకి తప్పకుండా అర్థమవుతుంది. ప్రభుత్వాలకు అర్థమవుదు, డాక్టర్స్కి అర్థమవుదు, బట్ స్త్రీలకు అర్థమవుతుంది. అందుకని వాళ్ళతో టైం స్పెండ్ చేస్తే, సరిగ్గా కనుక మీరు చెప్తే ఎంత బాగా అర్థం చేసుకుంటారు. ఇప్పుడు నా దగ్గర 2 years కూడా వెయిట్ చేసి కన్సీవ్ అయిన వాళ్ళు ఉంటారు, ఏళ్ళు వెయిట్ చేసి యూట్రస్ని ప్రొటెక్ట్ చేసుకునే వాళ్ళు ఉంటారు. అది మన నమ్మకాన్ని బిల్డ్ చేయడానికి టైం పడుతుంది. ఒకళ్ళిద్దరు చేసుకున్నారు, మీ మాట వినలేదు, డోంట్ వరీ అబౌట్ దమ్.
Okay, ma'am.
ఎవరు విన్నారు వాళ్ళతో బాగుండండి, సరిపోతుంది.
Thank you, ma'am. Thank you so
థ్యాంక్
much.
యూ.
కామేశ్వరి గారు ఒక చిన్న చెడుకు వేశారు ప్రభుత్వాల మీద. ప్రభుత్వాలకు కూడా అప్పుడప్పుడు అర్థమవుతుంది. I think you remember, Kameshwari garu, that when you brought this to the notice of Mrs. Charathan, Mrs. Charathan was the principal secretary, both health and also women welfare in this state. She immediately removed. అక్కడ రాశారు కదా. సో కైండ్లీ రికలెక్ట్ దట్ పాజిటివ్ కాంట్రిబ్యూషన్ ఆఫ్ ప్రభుత్వాలు. రెండవది, when I sent this to Mr. అక్కడ ఆంధ్రప్రదేశ్లో కృష్ణ బాబు, who was the principal secretary health, within 15 minutes he removed this from the Arogyasri. కాబట్టి ప్రభుత్వాలు కూడా అప్పుడప్పుడు పనిచేస్తూ ఉంటాయి అని దయచేసి గమనించాలి. జస్ట్ సేయింగ్ ఇట్ ఇన్ అ రైటర్ వెయిన్, బట్ ఇట్స్ ఎ ఫ్యాక్ట్ దట్ మోస్ట్ ఆఫ్ ది గవర్నమెంట్స్, not so much the political leader, but the bureaucrats and the professionals need to sensitize the governments. I don't think political leaders are really worried about stopping any or continuing any unethical practice, most of them. It's the job of the tenacious bureaucrats and the professionals to take it forward. That's what I wanted to submit to you, and I'm sure you will occasionally come across ప్రభుత్వాలు కూడా which will do some work. Okay. Yeah, any other question? In fact, when we wanted to, I took Dr. Kameshwari and Dr. Prakash to Krishna Babu. It was very, very positive. I think there are a lot of people who are in the system. We need to identify who are those fellows who can be of help to us in connecting with the right kind of decision making. It's an iterative process. ఇప్పుడు మన ఇంట్లోనే మన పిల్లలకి చెప్పినప్పుడే ఒకసారి చెప్తే ఏది కాదు కదా. కాబట్టి ఇట్స్ అన్ iterative process. We need to go on reiterating what we consider is the right kind of thing. And I'm happy that I've known Dr. Kameshwari and Mr. Prakash, Dr. Prakash, for the last 10 years. We were able to showcase, we were able to present their phenomenal work probably at different places. And I'm extremely grateful for that. Any other question? Any other questions, please? No questions from men except from Professor. No, if there are no questions further, then we'll request you, sir. It's an interactive session. We would like to listen to as many people as possible. should ask questions. In fact, I find that the students of my college, of which I am the chairman, are far more inquisitive when I take people from different walks of life. So I think you should compete with the students of Andhra Mahila Sabha Arts and Science College in asking for questions. You are all great professionals, very bright youngsters. So please ask questions. Yes, sir, Pradeep Reddy garu.
Madam, with this kind of work, I'm sure you must have got into these double-blinded randomized control studies wherein you have already presented the data also, where women who have undergone hysterectomy, what has been their lifestyle, life outcomes, and what have been their morbidities. So I was wondering whether this has managed to go across to the rest of the states of the country.
Yes.
Has that been happening?
Yeah, basically what happened was this study is basically supported by the Department of Biotechnology, Government of India. So because sir said I need to tell you publicly.
Yes.
We went in 2006. We were prompted that we should be given, okay, and then we put some small budget. They said बहुत कम है, ज़्यादा डालो. Then it was 2 crores, okay. So between 2006 to 2008, the project was around 2 crores is what we presented, and they given us 5 lakhs. Okay. With 5 lakhs, what they did is, the top 2 objectives they didn't support. We had a first objective, second objective, the third objective. So the third objective they supported, and we were into tears because 2 years they kept asking us to escalate the price and all that, and finally they gave. The reason why they didn't give us 2 crores is our bank accounts never reflected crores. Because our organization runs on kind, it doesn't run on cash. Okay, so that's the reason they gave. And as we completed then what happened, like the European Commission, they chose 5 case studies which they wanted to probe further. That's how the European Commission has, on the health side, they have taken our work. They asked us to do a deeper study. That's how we entered again into Udera. For 3 years we did, for 172 families we followed it. The open source document is very well available, what we did in 3 years. And it became an example for others. So the people in Delhi who are very good in these pyramids and getting things done, NGOs, they just removed my name and just added another name to my name, and they said it is their work. Okay, then we promised ourselves that we should never go to Delhi, because in Delhi what they do is, they know exactly the NGO, how they operate is quite different. But parallelly what happened was, Gujarat has come forward, Gujarat has done the study, Rajasthan has done the study, basically in work, and now we have voices around. And now the government of India has
we didn't mention that. Based on our study, we till that time, 2013, national level data was not there. Only DLHS data was there, excluding few states and other things. So, but based on our study, they included hysterectomy data first time in NFHS. So that's why 2015 data is available. Same. Andhra and Telangana were highest, same story. And the numbers are rising, same story, but they could collect the data.
Right.
So that no, we are,
yes,
we are also waiting for a report which I think you have been promising to give. I'm sure that report will come. Once it comes,
what happens, sir? Because as clinicians and Chakrapani garu says pursue it and do, but we have to do ethical practice, earn and spend on the organization. And so I'm not a researcher actually. I try to do research, but most of the national organizations have research collaborations. It's very, very difficult to get them. So, and also talk to them is difficult. And after doing that, they say these are the gaps. So it is not a hospital-based study; it is a community-based
Yes.
study. We have definitely in our this study. After this study, we did another study from 16 to 20. So what people are saying, actually, in this study, we could register 500 women. All are below 40, and their AMH levels are much worse. So what they say is endocrinologists from NIMS, you don't have data about oophorectomy. If the AMH value is not detectable, it is equal to oophorectomy. So without oophorectomy, we can see still traceable AMH.
The problems are there.
So that's why our study has halted. Actually, we study it very thoroughly with the help of NIMS, but how to analyze that? So my energies are not sufficient actually. So yeah, I'm asking, and now what I'm planning is, again from 59 districts I'll study further and I'll document and I'll come back.
Yes,
So that's the
madam.
thing.
Madam, I'm actually, this kind of community-based study is equivalent in pediatrics of what you heard of the Bang couple, madam, of Gadchiroli, what they had done for neonatal care. So this study is actually equivalent of what you have done, and ultimately whatever study they did in community newborn care, that became the standard of care the world over for community newborn care. So I can see that this kind of study can become that standard. So my humble request is that if you can get hold of the right scientific community, I'm sure there are many backers who can do this work. I have a selfish interest in that, because by this study, hopefully you can do that thing, the same thing for the cesareans and as well as for the so-called under 5 mortality rate due to malnutrition. So hopefully this kind of study can become the starting point for under 5 undernutrition as well as tracing of those unnecessary cesareans that are happening in this country, and of course unnecessary bottle feeding that's happening. So hopefully this will become a standard document for tracing out those newborns. Thank you so much for that answer. Thank you. Thank you.
Thank you. We have also been talking to Dr. PRAKASH Reddy, an outstanding scientist from NIN. We have met Dr. PRAKASH Reddy a couple of times. In fact, I'm going and addressing them, their staff, on 22nd. Anyway, I've requested Dr. Krishna Rao to kindly invite Dr. PRAKASH Reddy, who is a very reputed, highly reputed scientist from NIN, to talk of nutrition and related issues. So thank you very much. It has been a very interactive session. All my good wishes to you in this regard. Thank you.
Thank you, sir and ma'am, for sharing your wonderful insights and inspiring us. Thank you, Chakrapani sir, for moderating the session.
Sir, our college management is in full support, sir, of the library activity as well as the cooking festival, sir. We are looking forward to that, as well as you have already mentioned before, the debate and the discussions. We are eagerly waiting for that session also. Whenever you guys are okay, we can plan it, sir. Thank you so much, sir. I extend my heartfelt gratitude to the distinguished speakers, Dr. Samaveda Venkata Kameswari ma'am and Dr. Prakash Vinjamuri for their insightful and thoughtful provoking contribution for today's panel discussion. Your dedication to women's health and your valuable perceptions have truly enriched our understanding of the important subject. Once again, we express our gratitude and appreciation to our esteemed guests and everyone present here today, sir. Thank you so much, sir. Sir, for national anthem, sir. Everyone, please rise for the national anthem.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे